Okay, good morning from Montpellier, and welcome to the first workshop of the SynAir-G series, Improving Indoor Quality for Healthier Children. So this is the first episode of a series of 3 workshops organized in the framework of the EU Horizon Europe-funded project SynAir-G to share knowledge on the issue of indoor air quality and its impact on our health. So it's such a pleasure to see you here in Montpellier in this splendid setting in the Faculty of Medicine. And thank you to the University of Montpellier for hosting us today. And also I would like to extend a warm welcome also to our participants who joined online. Welcome, thank you so much. So this workshop, we hope that this workshop will be an interactive event. So we will ask questions to our experts, and we expect that you do the same. So don't hesitate to raise your hands if you are here. Otherwise, if you're online, please write your question in the chat, and my colleague Agatha will be taking care of you, and we will monitor the questions, and we will try to answer to all your questions. So let's start. So today we will discuss a topic that is becoming more and more important and also preponderant in the agenda of policymakers, as well as research priorities in Europe. So we are talking about indoor air quality. And when we talk about indoor air quality, we refer to the quality of the air in and around buildings and structures, especially as it relates to health and comfort of the occupants of those buildings. Now, I didn't know, but when I researched for this project and this workshop, I found out that we are called the indoor generation. And this is because we spend on average 90% of our time indoor. And children, of course, are not exception to that. So you can imagine that the impact of that on our health. And this is not happened, I mean, this is not started during the pandemic. It goes far, far before the pandemics. So during these 2 hours, we will take stock of the status of indoor quality in schools across Europe, especially, and discussing what is the impact of indoor air quality on children's health and well-being. I won't be alone today. As you see, it's my pleasure to introduce Professor Nikos Papadopoulos, who is, of course, the SynAir-G coordinator, but he will also be the co-moderator today during this workshop. I have to read because Professor Papadopoulos' career is so many achievements that I have to read all that he did. So Professor Papadopoulos is a world-leading expert in allergy and asthma. During his career, he has identified some of the key mechanisms leading from common viral infection to asthma exacerbation and persistence. He is professor of allergy and pediatric allergy at the University of Athens, honorary professor at the University of Manchester. He has participated and led high-impact EU research projects from FP5 to Horizon Europe, actually served many international societies, such as the European Academy of Allergy and Clinical Immunology. He has received several international awards and published more than 500 papers. So today he's here as the coordinator of the SynAir-G project, and he will tell us more about the project, the objectives, and the ambitious goals. So, Nikos, maybe you want to address some words to welcome our participants. Is that one?
Okay. First of all, thank you very much, Valeria, both for those great words, but also for organizing this workshop. And of course, I would like to thank IFA generally for being involved and for leading many of these activities which are related to patients with airway diseases and allergy. And of course, I would like to welcome you all in this workshop, thank all the presenters, the speakers, but also the audience. I think that we are living in quite challenging times. You will probably agree with me. And while the last, let's say, 20 years or 30 years, which I remember very well, while doing research and trying to improve the world, it was about, improving things and becoming happier and wealthier and everything. Now it's more about saving the world rather than making it bigger. And in this respect, we have some topics that, whether we want it or not, we will all need to concentrate, and we will all need to put our best effort in order to solve us, starting from what happens with the planet and with everything that is related to that. Of course, you well know that pollution, in its general sense, is one of the major issues that is related to what we're experiencing in the world today. And from the wide aspect, because pollution is a lot of things, but there are different aspects, and we need to put as much attention as we can to each and every of these aspects. Again, we've been for several years looking, and several people have been looking into pollution in the sense of outdoor pollution from chemical pollutants. But now we realize that we need to focus more into indoor spaces. And as Valeria said, we spend most of our time indoors. We spend most of our time indoors in meetings, and I'm not sure. Well, I mean, we do need to make them work. And also focus, of course, on the most susceptible of the individuals, which are children and patients with allergy and airway diseases such as asthma. So we will try today to look at the situation about the indoor air quality in schools, particularly where children spend a lot of their time, and also try to talk a little bit about the impact on their health and what this project SynAir-G, but also other similar projects in the IDEAL cluster are doing about it. And we would like to bring you in this group and try together to work towards contributing a little bit in a wider aspect. We need to be aware that we are trying to save the world altogether. And with that, I think I will pass it back to Valeria to, to Isabella. So I have to introduce Isabella, and perhaps I can introduce the other speakers that I know very well. And Isabella Alessi-Maezano is a professor of respiratory medicine here in Montpellier. She's one of the most famous and successful researchers in the field of exposome, or in the field of the external exposures of the environment and the effect on health. And she is part of SynAir-G. We are actually really very happy that she is with us and also hosting today in Montpellier this workshop and the SynAir-G meeting. Isabella?
Yeah, thank you very much, Nico, to very kind words on me. And I would like to, first of all, thank IFA, CHU de Montpellier, who is organized that, is a partner of the project, all the people are here and those that are connected, and more in general, the community. As Nico said, we are living in a challenging world. I would like to just underline that there are many products, apparently 300,000, more than that, I think the 60 that we have around us, and the SynAir-G will try to disentangle some interaction, which is a very important topic. This is susceptible population. So thank you very much to everyone, and welcome in Montpellier, where we are going to work well, I'm sure. Thank you.
Thank you so much, Isabella. Okay, so I think that we can start digging really into the discussion. So as you see, we have a panel of experts, multidisciplinary experts, and also online we have someone who will also participate to the discussion. So our speakers now will present the status of indoor quality at national level and share their knowledge, but also their particular perspective, because we have, in fact, we have researchers, we have clinicians, we have patients representatives that will talk about different realities and the different angles of the indoor quality in schools. So now, yeah.
Do you want to present, Pascal?
I will, yes, so we will introduce you briefly our speakers today. So we can start with Madame Pascale Couratier. Pascal is a patient advocate and general director of AFPRA, the French Association for Large Allergies Prevention. After 15 years in the association and 10 years in its presidency. Pascal holds a degree in habitat and respiratory health, and she worked as medical advisor in the indoor environment as a prevention officer. She participates regularly in working groups, national and European level, dealing with issues related to allergy prevention. Do you introduce Dr. Demoli?
Yes, I think that is a privilege, and I like very much the fact that I present Pascal Demoli. And I'm not going to be reading because I know him for many years. Pascal is one of the most famous and successful respiratory and allergy leaders, researchers, and clinicians in the world. And it's not only about numbers of papers, but he has, put his mark into allergy, having contributed and led the WHO terminology for allergy, ICD-11, and among many other things. So he has been really very active, both on the research front, but also organizing things both locally and internationally. So we are actually very happy that we have him with us and also within the SynAir-G project.
Thank you so much. And also I would like to introduce you our speaker online, Dr. Arthur Badida. Arthur, I hope that you can hear us and that we can hear you. So maybe we can do a little test.
I also hope that you hear me. Good morning.
Perfect. Great. So Dr. Badida is an associate professor and head of the Department of Informatics and Environmental Quality Research in Warsaw, in Poland. His scientific interests are closely related to the environmental determinants of health impact assessment, and with particular emphasis on the influence of ambient air pollution on the environment and human health. He is member of numerous advisory groups in the public sector and commercial enterprises, as well as of scientific societies dealing with environmental issues, epidemiology, and medicine. And he is also former advisor to the Ministry of Environment and the Republic of Poland. We will have also another speaker that will join us later. Unfortunately, she has a bit of delay with her flight, Dr. Papadaki. But I will introduce her when she arrives. She's also a professor in pediatrics allergology at the University of Athens, and she also part of the SynAir-G project. Okay, so now we are done with the presentation, and we can start with the questions. So again, if you have any questions for our speakers and you're online, please write your questions on the chat. If you're here, raise your hand, and we will give you the mic. Let's start with Pascal Couratier. Yes. Okay, Pascal. So we would like to know from the allergy patient perspective, how important is the quality of air in schools, and how quality of air is perceived from patients, and if you can give us some examples of patients of your association, and which is the perception and which is the experience.
Okay, thank you for giving patients a voice. Air quality in school is of crucial importance for all children and even staff, but it is even more important for students with allergies. ALFRA is patient organization, and it receives testimony a lot from parents on the difficulties encountered at school. To start, we can talk about nap time at school. We received many testimonials from parents who inform the teacher for the difficulties that nap room can create with pillow, soft toy, blankets, problem with dust and mites, presence of humidity, or oven mold. We know that there's biological polluants are aggravating factor, even causing asthma attacks and promoting rhinitis in sensitized children. Unfortunately, parents are not always heard and very often judged or described as overprotective parents. In addition, there's room dedicated to nap are often too small compared to the number of children that's accommodated. On the below, they are regularly ventilated. Moreover, weekend about the problem of classroom maintenance, I can share with you the testimony of a mother whose daughter is polyallergic and asthmatic. She reacted regularly at school. The mother noticed that despite the cleaning down in the classroom, there was still a lot of dust, especially on classroom chair, and in the space between the wooden plank, and the iron accumulated a lot of dust on the shelf. The solution, Mom offered to clean the classroom herself. In this case, we can see a positive point, which is that the school has understood what is at stake for the child and accepted the intervention of the mother. So every 3 weeks, she did effective dusting. The ideal would have been for the maintenance instruction to be adapted, but the municipality understood the problem and let the mother take action. Very quickly, a final testimony related to the maintenance of classroom and the use of cleaning product. A young boy, developed severe rhinitis as soon as he sat down in his desk. In short, the child was reacting to the product used to clean the tables. The family took a while, but finally managed to have the product replaced with a less aggressive product. But in fact, to win their case, the family made the staff aware of the risk that they too would take.
Yeah,
thank you. Sorry, I need to improve my English.
Thank you very much. I think it's really important to have these testimonies from patients directly, and they highlight some important aspects here. And from what you have described, you already see two somehow contrasting aspects. In one case, it was a dust that needed to be removed because the patient was either sensitive to dust or they felt that they were sensitive to dust. On the other hand, it was a cleaning agent, and we have these problems. And although we know that sensitivity to dust can be an allergy or can be an irritating factor, and when it comes to cleaning agents, things get much more complicated because we only know a little bit about how much you can, what kind of effect the cleaning agents have. So we do need to understand this much better. But I wanted to ask Pascal Demoli, since Pascal has done lots of epidemiological studies, and do you have any insight on what is the impact of indoor air quality, either at schools or general indoor air quality, to allergic people, to people with asthma in France, for example?
Thank you, Nikos. I think it all comes with case reports. We start with those cases that actually affects the most either severe or uncontrolled patients. But what we are missing is the action of those pollutants and other products on everyone. And that's actually what I was about to say in my part. And having said that, SynAir-G is a fantastic study that will actually prove it. We do have surveys, but I would say quite weak in our country. Isabella would maybe develop on that. And old, some are a decade old, and new products are being used currently. The buildings are constructed differently. And I think that as well that there are differences in different regions. For example, here we are surrounded by vineyards, right? And apparently we are the world's biggest vineyard region. In Occitanie.
We tried the wine yesterday, yes.
Well, they're good side of it. You tried the good side, but we have politicians, local politicians that build schools in the middle of the vineyards, telling that they are going to be in the nature. And of course, all the pesticides are concentrated inside the schools. So we don't have immediate detrimental effects, but I'm sure we're going to have on the long run. So my advice is to use those case reports that Pascal described nicely, and say, okay, these are the children and the people that are the target, the first target, but that's only the tip of the iceberg. And we are all suffering from this thing, and but in order to prove it, so the answer is no to your question, and that's good, because the SynAir-G will address some of these issues. So we need to monitor, follow cohorts, and prove it.
And maybe we can actually turn a little bit to Isabella, who has a lot of data on things like that. So do you want to add or expand or give us your perception?
Yeah, thank you very much. I'm going to talk about what happened in the general population, because I leave the patients to themselves, as we heard, to a physician dealing with them. So we were very surprised, first in France, with what the so-called 6 city studies, in which we had 9,000 children in primary schools, and one child out of 3 was exposed excessively to at least 1 air pollution, based on the WHO level at that time. We know now, if we don't know, I'm going to repeat, since 2021, WHO has lowered the level acceptable for having healthy individuals with the new guidelines. So, but at that time we had the 2005 still quite protected. And we were very surprised. What we saw also is that when children were in these classrooms with low, with high air pollution, so low air quality, they had more asthma-like symptoms, more eczema, which is sort of strange in some way, but we know since then that the skin breathe also. That's very important not to be forgotten. And also some that was strange. But I mean, and with this was really the reason why we promoted with other colleagues the Symphony study that is funded by DG Sanco in Europe, with many countries, 23 countries in Europe, in which we did better, because we didn't have only chemical air pollution, but already biocontaminants, molds, virus, and bacteria, and endotoxin. And this study, although finished, is still going on, because the data are so many that we are meeting every now and then and discussing on publication. So main results were that once again we confirmed that children were highly exposed. We also find that 4% of children had bad asthma attacks in classrooms that was needed an intervention with the physicians in situ. That means a really very bad attack. And then also we confirmed that obviously effect on respiratory health, on dermatological issues, and also on performance of the children in school. And we found that both fungal DNA, sorry to use difficult words, but it's a way to characterize them, because the fungi in the air are many, and endotoxin are still related to asthma-like symptoms. And then this was deepened in another European project, HAZE, but that confirmed the same. What was needed? This is why SynAir-G is there, that we had a sparse study, one relation there, etc. We need to understand how all these pollutants, contaminants interact, how they impact the health. That's why SynAir-G is there.
Thank you, Isabella. Maybe now, because you talk about France and the situation in France, but Artur, do you want to maybe give us some data on what the situation in Poland? Because we know that in your studies, you identified some of the main issues, especially in some highly polluted Polish regions, and the impact on children and adolescents living in those areas. Do you want to give us some figures, some data on that?
Yes, I hope that you can hear me. Yes.
Yes, we can.
Okay, so so the situation in Poland is definitely worse than in France in terms of air pollution, air quality. Actually, we can observe that the situation is definitely not good. However, it is improving systematically, but still we have some regions in Poland where it is really, really bad, especially in the southern part of Poland, in the Silesia region. So it's the industrial area or post-industrial area in some parts, but there is also. So generally, the problem of Poland is these are the emissions from households heated using solid fuels. We have a lot of such households in the south of Poland. So that's why in our several studies, we compare different parts of the country and the health status of people living in these areas. So usually we try to take into account the cities from the southern part of Poland, where the air quality is really bad, the central part of Poland, so including Warsaw, where the air quality is a bit better, and the northern part of the country. So usually the cities at the Baltic coast, where the air quality is usually quite good, sometimes really good. So because in one of the questions you mentioned about the paper concerning children, yes, so in our studies we also focused on children. We made more than one paper about the state of health of children living in different parts of Poland. So in one of our study, we took into account children aged 9 to 15 years old living in two cities. It is in Zabrze, which is the city from the south of Poland in the Silesia region, and the city of Gdynia, which is located at the Baltic coast. So at the Baltic coast, generally there are no major sources of emission, so we can consider the air quality as quite good. And in the study I mentioned, we focused on children, as I mentioned, aged 9 to 15. In total, we had 770 children. We took into account their exposure to air pollution. However, it was the outdoor air pollution, yes, because the outdoor air quality is something what we can what is measured in the as a part of the state environmental monitoring. So we have the official information about the air quality, which is commonly available and systematically collected. Unfortunately, in case of indoor air, I haven't heard about any programs, any studies, and especially any legal requirements to monitor the indoor air quality on a larger scale and in a continuous or systematic manner. So that's why we don't know exactly the scale of the impact of indoor air quality, because we don't have a lot of data. So there are some studies about this, but usually there is no continuous measurement within a longer period of time. Yeah, so that's why we took into account the outdoor air quality, but because from many other studies we know that most of the air pollution from outside penetrates into the interior of the buildings. we can also assume that this may cause exposure to breathing the air pollutants when we are also in the indoor environment. Yes. Of course, there are also additional pollutants in the indoor that are not present outside. So that's why the exposure to air pollution may be greater than we expect. Yes? So we compared children living in those two regions, and we have demonstrated that the lung function among the children living in the more polluted area is significantly lower in comparison to children living in the cleaner area. There were also more symptoms of upper respiratory diseases, of allergies among those children living in the more polluted area. So we can see the differences between the cities among the group of children of the same age. Very similar groups in terms of age, in terms of gender. So we can see the differences in the lung function, in the prevalence of respiratory diseases, allergies, and so on. Yes, but because we know quite a lot about the ambient air quality, but much less about the indoor air quality, this is one of the reasons that we are trying to identify the air quality in different parts of building as a part of the K-Health in Air project, which we'll talk a little about today later. Also, my colleague Jose Dominguez from Spain, who is the leader of the project, will probably tell you a bit more about this investigation.
Yes, we will hear about that later. Yes. Thank you, Arthur. So, and this lack of data, I think that can also mean that there's a lack of information for the general public on indoor air quality. So I would like to ask to Pascal Couratier. So do you think that there is enough information and that the public, the patients, but also the general public is well informed on the challenges that indoor air quality represents?
There is still... Merci, thank you. There is still far too much ignorance among public opinion. Allergies are often minimized. Some examples, we often heard, I'm allergic to my mother-in-law, or I am allergic to idiots. J'ai pas pu faire allergique au boulot, je sais pas le traduire.
Word.
And or even in today's day, I'm allergic to school. Recent news in the region, in the south of France region, perfectly illustrated this incomprehension to the ignorance. Indeed, the press took up the case of a college professor who reacted to products such as deodorant, perfume, air spray, or gel. For example, here are the titles taken up by the regional and national press. Their teacher is allergic. College students are banned from using deodorant. Otherwise, they will be punished. Another title, it stinks of sweat. This is all several students at the college in Menton complain about. Another title, Menton, the city Menton, Menton student deprived of deodorant. I will spare you the comment on social network, which were not always kind. Moreover, we know how important it is to ventilated classes to preserve indoor air quality by reducing the level of CO2 the attention of all students will be significantly improved. But in these times, when we talk so much about energy saving, how can make people understand that this energy saving is indeed important, but that the health of our children is much more important? Opening windows even in winter is a simple and effective measure. It is really the lack of information and knowledge that perpetuates this type of behavior. Thank you.
Thank you, Pascal.
Yeah, and I think that it's not surprising that we have this type of reactions to this type of ignorance, let's say, because there are some things which are very difficult to understand, even for the experts. There is so much variability in many levels, variability in what you get between schools. Before we heard about variability within a country and that you can have different levels of pollution, but we know that there is also variability within one city. And so the extent of this variability is very difficult to grasp. And also, we are not aware in detail of all the effects that one can have on of the different products, let's say, of the different materials that we use on health. So we need the public to understand that there is an effect. So, but on the other hand, it's not very easy to describe this effect. And let me add, Pascal, because I thought about this question while we're talking before, about the generalization of any findings. What about the distinction between personalized medicine and personalized response and the general response? We have, there are some, things which are not very good, dust in general, but there are some people who are allergic and they are very specific and they will respond. So how do we manage a public health type of approach with a personalized medicine type of approach?
Well, I suppose that's the crucial question. I would suggest that we go from the top of this iceberg I was talking about, and maybe legislate on CO2, ventilation, mold, things for which we do have data, and maybe go down a little bit and have rules that are really flexible. And legislation is I would say would be too strong, but legislation on based on scientific data, hard data, and then go down and let the local people adjust according to the let's say phenotypes or of their citizens. And for example, in schools in which there are a lot of maybe peanut allergic patients, maybe food testing and cooking exercises probably should be banned according to the prevalence of that specific disease, but maybe not for rarer diseases in general. But yes, in one particular school, because there is a, let's say, sesame allergic child in that school. So general rules for the things we have hard data on, and then go at the national level, I would say, and at the local level, flexible rules in order to address the personalized issue you were talking about.
It is difficult, definitely. And yes, we need to have this type of modularity and this type of flexibility, which is not very easy at the public health level, where you want to have one thing. So we are kind of struggling.
Isabella,
yes, please, Isabella.
Yeah, I want to be provocative because, as Pascal was saying, we need to move. And for children that are allergic to some food in schools, there are plans that are, I don't know if I follow it, Pascal can say, but at least the idea that it is needed. So I think just like for outdoor pollution, we can think about indoor pollution with some rules that are so far are not followed. For example, too much CO2. We know when it's dangerous for children. Why not having something compulsory?
Yeah.
And I think SynAir-G is going to say that.
Hopefully,
yeah.
I was just thinking, Isabella, because you mentioned before the WHO regulations. Yeah. Is there anybody that follows the WHO regulations?
You know that according to WHO, 99% of the world population is excessively exposed. So this is difficult, but just to mention the French situation is the Ministry of Environment that is in charge of trying to protect people, and not the Ministry of Health, which is emblematic of the situation, because they should work together. Then there is one national agency that is just studying whether pollutants are bad or not. And in the past, we had one minister trying to say we monitor in order to act, but this was too much expensive, so it has not been followed. So it's difficult, but we have some criteria to well known, and in particular for these pollutants that are called the volatile organic compounds. We know that they are, unfortunately, by the International Agency for Research of Cancer, labeled as certainly at the origin of a cancer. So in school, when you have children too much exposed to benzene, you have to do something. That's my idea. It's avoiding or ventilating. There is a solution indoor, okay? But we need to monitor in order to act.
Thank you, Isabella. So meanwhile, Dr. Xepavadaki joined us. So welcome. Very happy to, fine, no worries. Very happy to have you here. So Dr. Xepavadaki is, as I said, is associate professor in pediatrics allergology at the University of Athens. She has been awarded with many international awards and participating in more than 30 national and international funded research programs. She is a current member in the Pediatric Asthma Board in World Allergy Organization and representative of the Pediatric UCare Edicare Excellence Center in Greece. She was a member of the Pediatric Board of the European Academy of Allergy and Clinical Immunology. And as I said, she's also part of the SynAir-G project, which, of course, yes. Vicky, we were talking about this lack of data, but also lack of information on indoor air quality and effects on health, especially on children. So I would like to ask you, Vicky, according to your experience, what is the level of awareness among parents and school, also that you experienced directly while implementing the study for the SynAir-G project, because you are implementing the project in the schools in Greece. So if you can share some insights on that, what is the reaction of parents and school when you talk about the issue?
Yeah. Thank you very much for the question. Well, it's not only the parents and the teachers, to tell you the truth. It's also the doctors. I would highly start from there. I don't think we're very aware that children do spend most of their time in inappropriate environments, at least not that dangerous, but we are not aware what is going on in schools at homes. So I would highly start from trying to educate doctors of what to say and what to suggest. Now, going back to the schools, I think we haven't started with the parents yet, but teachers seem to be, from one side, very interested in trying to improve the school environment, but on the other side, I don't think they know that much, and sometimes they are skeptical. We have this high-end van in order to try to measure or assess what is the environment outside and inside the school, and at least until now, we haven't got a positive response because they are afraid that it is something might hazardous to the children and what is going on to happen there. I think we have to be informed, and we have to inform the teachers and the principals and the public. And I think a lot have to be done. I was looking in the literature in Greece, and there are only some very scarce data about what is going on in schools. And it's not from the medicine school, it's from other scientists that want to assess the environment, but these are only 3 to 4 theses and publications, and not more than that. So I think there's a lot to be done. Yes.
Thank you, Vicky. I would like to ask a question to Arthur, because in one of your studies, Arthur, you monitor and you analyze the indoor air quality in kindergartens in Poland. In your study, you highlighted the importance of, as we said, as Isabella said, there are solutions. So the importance of ventilation and purifier. Can you tell us more about that, and how is the quality in kindergarten's classroom in Poland?
Okay, generally, ventilation is crucial, that's true, but this is also the source of air pollution, because as I mentioned, in the previous question, the indoor air quality is usually shaped by the outdoor environment, yes, as a result of the penetration from outside through the ventilation system, but also the doors or windows, so that the air penetrates into the interior of the building. Yes, the second major exposure is, of course, due to the air pollutants that arise inside as a result of presence of different types of emission, like fuel combustion, smoking of tobacco products, cooking, baking, or the release of several chemicals from furniture, from paints or varnishes that cover floors or wall surfaces. So, but actually, this study you mentioned was made because some years ago the authorities of Warsaw decided to equip every classroom in every kindergarten in Warsaw with an air purifier, so as to decrease the presence of pollutants inside the classrooms. It was made mainly because of the fact that I mentioned previously, so because of the poor ambient air quality. Yes, and we were asked to check whether this decision was justified and whether the air purifiers really improved the air quality in these kindergartens, and of course they can decrease the children's exposures. Yes, so we completed this measurement campaign in 4 kindergartens located in different areas of Warsaw, so exposed also to different sources of outdoor air pollution. So, for example, one of them was located in the vicinity of the busy street. One of them was rather in the cleaner area. One of them was in the area where there are many households heated by coal burning and so on. Yes, and we monitored the air quality in these classrooms during 1 week for 24 hours a day. And in each location, we compared 2 classrooms. So 2 very similar classrooms with a very similar number of children attending the classrooms and similar shape of the room. Yes. In one of them, the air purifier was constantly turned on, and in the second one, it was turned off. We also monitored the outdoor air quality in the same time, and what we observed, because of the ventilation system, these are really very simple systems, so the gravity or mechanically supported ventilation, but this is the ventilation that allows the outdoor air quality to penetrate into the interior of the building. So what we observed was definitely that the changes in indoor air quality quite strongly correlates with the changes in the ambient air pollutants concentration. That was the one observation. The second observation showed that the air quality in the rooms where the air purifier was turned on was in average 40–50% better comparing to the rooms where there was no air purifier, operated. So the differences in purification efficiency results from different criteria. So, for example, from the time and frequency of opening the windows and doors. It was the highest in the classrooms. So this efficiency was the highest in the classrooms where windows and doors were opened rather briefly and rarely. But of course, this is also not the solution because of, for example, the risk of mold presence that was already mentioned in our panel discussion. Unofficially, also the directors of the kindergartens indicated that since the air purifiers were installed, they began to observe a lower rate of sickness absence in children. Of course, as I mentioned, this is unofficially because this is something what we didn't monitor. So our research did not include such analysis, but because it was not the observation of only one director, but of all of them. So this is certainly something what requires more detailed and long-term research.
Sure. Yeah, I take the opportunity because I think this is quite important in pointing out that among many other pollutants, we have been realizing that what we call biological pollutants are at least as important as the chemical pollutants or the particles. And the major biological pollutant that we have experienced very much lately are the viruses. The viruses are very strongly associated with all the respiratory illnesses in children, and they are a major pollutant. We can not easily measure them in the air, which is a challenge. But we know, and that's something which we know as scientists, that it's not really generally known, that if you combine, let's say, pollution, chemical pollution with some of the viruses, or you have an allergen, which is another biological pollutant, together with a virus, then you highly increase the risk of getting a respiratory condition. So I think this is something to have in our minds. And of course, research like the one that you were doing is very important for bringing this forward. And do you think that the difference, I can follow up a little bit, do you think that the type of air purifier will make a difference, or any type of air purifier is better than no air purifier?
So definitely it makes a difference. Because in these kindergartens that we monitored, they were also equipped with different kinds of air purifiers. Of course, the number of these kindergartens was rather too low to compare every criteria, yes, because as I mentioned, the doors or windows were opened for in different frequency, different duration, so we cannot compare it directly. But in another study, we made also the comparison of different air purifiers, and what I would like to admit is that especially when we are talking about kindergartens or schools, it is very crucial to equip these classrooms with the air purifier, which is dedicated not for using at homes, but for using in offices, in other areas. So where, for example, there are different ventilation systems that exchange more air in these areas, because in homes the exchange rate of the air inside is like 0.5 in an hour, but in schools or kindergartens it is rather 3 or 4 times in an hour. And the air purifiers which are dedicated for using in homes will not be sufficiently efficient in classrooms, in schools or kindergartens, where there is a much greater exchange rate of the air inside. So that's why kindergartens and schools should use rather professional air purifiers than the one dedicated for homes. Of course, because we checked also the situation in kindergartens where the air purifiers dedicated for homes were used, we can be pretty sure that it is better to have anything than nothing. Yeah, so any air purifier than no one, but definitely using the professional air purifiers will much more efficiently improve the air quality inside.
Thank you, Arthur. So I think that we can do a very quick last round of questions, and then we open the discussion for the public. Yes, okay. So we talked before about, Professor Demoli talked about the importance of having standards and regulations from the public sector so that we can adjust and we can implement and we can uptake that also in our schools and our public dwellings. I would like to ask to Pascal Couratier, if you as a civil society perspective, have you seen any improvements in the last years on the regulations of implementation among the local authorities?
Yes, we are seeing improvement and awareness in government policies. About 5 or 6 years ago, a practical way to improve air quality in buildings welcoming children was put in place by the Ministry of Ecological and Inclusive Transition. Different themes were covered, such as building, household activities, manual activities, definitions of standards in particular for CO2, formaldehyde, and benzene. But establishment and communities were quickly faced with a lack of funds to implement and monitor this good practice. In 2021, in France, the PNSE4, National Environmental Health Plan, number 4, further defines the measure applicable in these establishments which welcome children and even students. Since j'ai pas noté. Tu peux traduire depuis début 2023 en fait, c'est applicable dans les écoles.
As of 2023.
Sorry, Pascal.
Ah oui.
You can translate. Pascal,
ok. Excusez-moi. Depuis en fait le début de l'année 2023, cette mesure est vraiment applicable dans les écoles, dans les crèches et les écoles accueillant les petits enfants.
Okay, as of 2023, this measure Pascal was talking about has to be applied in school for kindergarten.
Yes, and
is applicable. Sorry, it's not compulsory.
Yeah,
that's the main difference. Okay, because as to be applicable, it's applied.
It's not.
No. There is no.
If I may, it's normal. You have state decisions that are applied locally, and the schools are under the responsibility of the cities in France. So the state cannot demand some things without giving the money, because the schools are owned by the cities.
Yeah, since we went into politics, it's difficult actually to ask for a measure to be obligatory. Because there are, complications around it. So I think we will need to buy in the people who are responsible so that they believe it and try to do it by themselves.
It is a theory, not practice. C'est la théorie, non la pratique. And I invite you to consult the detailed measure directly in the minister website. Thank you.
So we need to have, of course, the politicians, but also we need to have the people themselves, the parents. We need to have the patient organizations, the doctors. Pascal, how do you think that these all can work together? Can they work together? Is there a focal point? Do we need to do something about it for the collaboration of the different stakeholders?
I think that's our duty, and I think that as doctors and scientists and parents and patients associations, I would say that these things have to be put in place locally. I think that's the only way to work on it. For example, Pascal was talking about the national environmental program. Actually, it's a framework that is written by the Ministry of Environment, has changed its name, it doesn't matter. And but locally, every single health agency has to pick up what is important for the region. So we have a regional environmental health program that is being written. The fourth will start in January 2024. And that's how we need, and there is a citizen call every single time. So they meet the citizens and we all decide what is important for our region. And Nikos, I really think that we need loose rules, as I said, on things that are based on strong science. And we need local application, has to be flexible. We don't want to force anyone at the time, but it's something that has to be in a strong march. I understand that, but not really mandatory. I believe in
the bottom-up approach, which I think works. I mean, it's more essential if it works. It's not always. Sometimes the top-up approach can be more efficient, but the bottom-up is more essential. I think it works sustainable. More sustainable.
Maybe I have the same question also for Vicky, because you're also a doctor, you're a clinician, you see patients and you visit children and you talk with families and parents. So how can we work together also to sensitize doctors that, as you said, maybe don't pay too much attention to this issue?
Yeah. Well, they don't. It's not really illogical that they don't. They have to deal with quite a lot of things. But what we have to realize, and I have realized that during the last, let's say, couple of years, not that long, is that this is as important as other things are in respect to the preventive strategies that pediatricians in particular are very active. So we need to inform people and doctors and pediatricians and general GPs that measures have to, we need to ask where they live and what they can do in order to minimize exposure. Things like avoiding dampness or molds at homes and trying to bring fresh air as fresh as it can be in Athens. One major point of pollution in Athens and probably other cities are the fireplaces, and they have become very popular during the economic crisis and the gas crisis during the last 2 to 3 years, but they are a major source of air pollutants. So probably trying to do something about that. But, we need to know and then try to spread the knowledge through our congresses and things like that to try to spread the knowledge all around, and then people will be also sensitized.
And do workshops.
Yeah, of course, as we are doing.
Yes, however, we still have, the challenge of the complexity. And Isabella is a specialist on that. The exosome is really something very complicated. How do we go ahead and try to describe it and try to understand it? How do we get into this kind of complexity?
That's a very good question. And I think that we really need to understand it very well before communicating, because this is, as you said, Vicky, it's really important to educate before everything, educate the medical doctor, educate the patient. The complexity can be in some way understood by taking good assessment of a measure of what is going on in the air. So chemical pollutants, biocontaminants, temperature, etc., indoor and outdoor. Take into account also these words, to me is very important, the sources, because very often we cannot assess directly one pollutant because it's too expensive, because we need to have the reply very soon in real time. That's an important issue. And then obviously to study statistically, but now we know how to do that, and taking into account there are also two approaches. You said the bottom up. So, but we will do that. But at the end, we should be able to provide very simple messages about what I call the avoidable exposome. So the interaction that are very nasty, these pollutants with high temperature, for example, or other characteristics has to be avoided, and so provide a recommendation that are easy to apply, because this is also an important issue. And to come back to real-time assessment in SynAir-G, we have this approach, which is really important. So having the results of the measure in real time. And this I'm watching Antonio in terms of biocontaminants or in terms of chemical, because if we need to act, we need to know that. In my experience in the school, we had some cases with, for example, in school in Strasbourg, we had more than 100 micrograms per cubic meter of formaldehyde, which is very dangerous for the children. We knew that only sometimes after, but still the assessment gave the same. And then we closed the classroom because the children were highly exposed to something that was dangerous. But this was exceptional. We need to include in our recommendation also some issue on how to assess in real time, and then provide, as I said, main messages about what has to be avoided and how.
Thank you, Isabella. So the last question for Arthur, because we are talking about this need for research to also inform policymakers to make some science-based choice. And Arthur, so we said before that you are working for the Key Health in Air projects, which is part of this ideal cluster that we will talk about it later. But can you just give us some insights on what's your role in the project and what you are doing across Europe for Key Health in Air?
Yes, thank you for this question. So as a university, we are involved in the project. We are focusing on the identification of air quality in various types of, so generally the project is focusing on the identification of air quality in various types of buildings and the exposure to air pollutants arising inside these buildings. So we are responsible in Poland, but also in Austria, for the assessment of air quality and the state of health in schools and households. Actually, in Poland, we equipped the schools and the individual households with the continuous measurement sensors. Yes, so we installed these air quality monitoring devices in 7 primary schools and in 15 secondary schools. And we are also during the process of installing these measurement devices in 35 individual homes, which are heated by different sources of heating, yes, the different fuels. And thanks to this, we can observe the continuous changes. So this is what I mentioned previously, that it was, so I haven't heard about any other research where we could observe the continuous changes in the air quality during the longer period of time. So we expect to do it for at least 2, even 3 years, yes, to observe the continuous changes in the air quality inside school classrooms, also in homes. But in school, it is crucial, yes, because we can then observe the children's exposure to various types of pollutants. And generally, in our measurement, we focus on particulate matter, yes, so especially these tiny particles which can penetrate the lower respiratory tract, but also on some gaseous pollutants like volatile organic compounds, like formaldehyde, which was mentioned by Professor Isabella, but also carbon dioxide, which is also important from the point of view of the quality of the air inside the building. So in some schools, we will also measure the concentration of polycyclic aromatic hydrocarbons. Yes, so these are also the carcinogenous substances, but also the microbiological pollution. Yes, it was mentioned already that it is also important. Actually, we will not measure, we are not able to measure the concentration of viruses. So we are focusing on bacteria and fungi. As a result of this project, we actually expect that our knowledge about the air quality and the exposure inside the buildings will significantly increase, that we will know much more about the various pollutants in various types of buildings, but also the effects that this exposure can have on changes in the state of health, or at least on well-being, also among children, which is really crucial. Yes. Thank you.
Thank you so much, Arthur. I think that we can take some. If you have other questions, Igor.
Well,
of course.
I was having a question. I was thinking whether I would ask this question, Vicky, or to the whole audience, because one of the challenges that we have is actually to do something now, and something that we have to do now is be able to identify sources of potential pollution, let's say, and try to do something about it. And this is something which is practical. So I would ask anybody or everybody, can you identify in this room at least a couple of sources, of potential sources of pollution that we can? Yes, of course, there are several experienced allergists here. And yes, there are.
May I take the floor?
Yeah.
Because you know that we are in charge of this working group, work package on the sources, and Chiara Pucci, who is there, she will train tomorrow people that want to be trained about how to identify sources. So there will be even a quiz at the beginning, and then at the end, a sort of treasure chase, how do you call that? Looking for the treasure hunting. Yeah, treasure hunting. Thank you so much. So here, yes, sure, there is a moquette, so the glue for moquette, then you have many, curtains. But curtains, etc. But what is even worse is what can be entered from the door. So there are no room, no apparently.
There's a window, yes,
There is a window, so but it's closed, so it's certainly hermetically closed. But so just to make a synthesis, we have prepared a matrix in analogy with what is called the job exposure matrix. We have a source exposure matrix. So you have the source that you see physically, and there are the pollutants that are connecting according to panels of experts or the literature. And then we can be sure with speech also, etc. So 2 tools, questionnaires, checklist, and matrix to assess the sources. I think this will be useful because it's costly to assess pollutants very often, but if we will know the source, we can assess more or less the presence. There is also a gradient, etc. But the concept is very simple.
Yes, great. Thank you very much. I think this worked. And we do have a little bit of time, right, to
yes,
for questions and
to take some questions,
comments.
Yes.
Nobody on the...
This will be, Agatha will tell us if there are online.
You have to press the second from the right. No. Okay, here you are.
This one. Okay, you hear me?
Yes.
Good morning to everyone. I'm Thanos Damelis from Thessaloniki, professor of climate change and ecology. Also aerobiology, I work a lot in environmental exposure, exposome, and so on also. So actually, I wanted to ask what Nikos already said about the complexity, because of course we need more data. Of course, it's a question of generalization versus individualization. But in the end, it's about complex data. And I will give 2 brief examples of some work we did in Lithuania and Germany. So we did also work in schools, primary schools, and we found differences not only between countries, between cities, between neighborhoods, because of urban, non-urban, pollution, no pollution, between classrooms, between days, between hours. Yeah. We found differences between different places within each classroom. We found differences on the surface of the desk of the teacher more than on the children for some reason, which we don't know. We found near the windows, even if they were closed. And we found also differences between corridors and the classrooms. So we had more in the corridors than in the classrooms, which means that it's much more complex than maybe we even imagine. So that's a big task. And that's why I'm happy to be in SynAir-G, because that's a big challenge, which I think we can manage. And we also checked purifiers, unpublished data. We saw that we used one brand, but we saw that it's not even about the purifier, but it's about where you put the purifier, because sometimes it was more efficient, of course, sometimes not. And in the end, we found that the intervention we suggested in that paper is that it's not even about very, sophisticated things. But for example, we saw that in classrooms, we know that usually they don't clean that much. And it was as simple as cleaning the windows, because they don't ever, because nobody goes up there to say, let's clean it. We haven't cleaned it for 5 years. And we saw that obviously the carpets, okay, they are more used, frequently cleaned, but sometimes it could be something very simple for such a complex, actually, problem. That's all. So the question, because I need to make a question, right?
Well.
So is that, could we in the end, through SynAir-G or other projects, promise for operational predictions? I mean, if you consider how complex it is, can we promise that we can make operational predictions, interventions, and that when say to the policymakers, we can do ABC and we can save, let's say, the health of the children?
Yeah, we can. I mean, there will be, it will be very simple. Pascal mentioned before. So there will be some things that are clearly bad and that we can somehow intervene. And we will start from these general measures, not allowing smoking. That has been, for many decades, people have been smoking in schools. So you don't allow, people coming to school after smoking because you carry the tobacco on your clothes. So
no vaping is not forbidden.
Yeah. And vaping, something like that. This is just an example. And I think that we will have to take these steps while we were trying also to understand the complexity and try to do this data reduction kind of exercise from the complexity that we will need to understand, try to see where the intervention can have a practical effect, which what we'll try to do in SynAir-G. Where can you target and have a health effect? But it is a great question, and yes, it is a great challenge as well.
The avoidable exposure.
Okay, I think that this is if there's no other questions in the public or online, Agatha, you are monitoring, okay? So I guess that this is a very, first of all, I want to thank you all for our panelists. We are now moving to the next session, and I think that Thanos' question was the perfect question to move on to the next session, because I guess that the challenge that you mentioned, this complexity, is a common trait between the different projects of the working in indoor quality. So now we see on the screen our other speakers for the session. Welcome. So we are going to hear from the researchers involved in other EU-funded projects, and of course SynAir-G, working to better understand the component of indoor air quality, the risk of indoor air quality and air pollutants present in classrooms, but also in other public dwellings, and the interaction between pollutants and outdoor and indoor pollutants. So, but we want to also to hear more about the solutions that we are developing to ensure cleaner air and healthier environment. So all these projects that we are listening from today work in close cooperation within the IDEAL cluster. The IDEAL cluster is an initiative promoted by the European Commission to improve and safeguard health and well-being of citizens in indoor environments. The cluster is composed of 7 projects, and today we have representatives from 3 of those projects. Of course, SynAir-G, we have Key Health in Air and in Child Health. So I'm very happy to introduce our speakers. Of course, Nikos will stay here because he will talk us about, no, you can stay, Isabella, don't worry. We all stay here. Nikos will talk about the SynAir-G project, and then we have Dr. Jose Dominguez, who is the coordinator of Key Health in Air, and Dr. Evangelia Diapuli, I'm sorry for the pronunciation, but maybe you can correct me, who is a PI researcher of the In Child Health project. Now, Dr. Dominguez is a program manager, and he specializes in natural resource and climate at Cartif, a non-profit research institution based in Valladolid in Spain. He graduated in chemical engineering at the University of Salamanca, and he has been working for Cardiff for the past 23 years, running multiple projects. While Dr. Diapuli is a principal researcher at the Institute of Nuclear Radiological Science and Technology, has a very long name, Energy and Safety, the National Center for Scientific Research, Demokritos. She holds a chemical engineering diploma for the National Technical University of Athens, Master of Science in Environmental Engineer, and a PhD focusing on indoor air quality. Dr. Diapuli has more than 20 years of experience in studying indoor ambient and air quality, and she's been actively involved in many European initiatives to develop standards methods for aerosol characterization. So, and of course, now we want to hear more about your study, your research, and what is going on these different projects, their aims, their objectives, their challenges as well. So let's start with a very overview of your project. So if you can tell us more about the project that you coordinate, the aim, and what are your plans to improve indoor air quality? I don't know, maybe Jose will start.
Okay. Well, good morning, everyone. I'm Jose Fermoso, in fact. Dominguez is my second surname anyway, but
sorry.
No worries. I'm very proud for both of them. So, but regarding Key Health in Air project, our main aim is identify the main determinants in several relevant environments, indoor environments, in fact, that we can find across Europe. To do so, we select, we we first have an approach with two different focus. From one side, we know that we have medium or long-term effect of many pollutants or many potential determinants. So we carry out a first approach by doing like a scan of these relevant environments, and we select for them representative spaces, indoor spaces across Europe. For example, two hospitals, one in Barcelona, the Clinic Hospital, and then the other one in Rotterdam, the Erasmus Medical Center. Then several schools in Austria and in Poland, as you listened before from Artur, from my colleague Artur, and also a senior home in Rotterdam also, but also other spaces like a metro station or a city market or three canteens in Germany and in Norway. And to do this scan, we have planned a 2-3 year of monitoring campaign, combining these monitoring tools that Arthur presented before. We are going to use a monitoring tools to monitor for sure temperature, humidity, carbon dioxide, but also particulate matter, total VOCs, and also formaldehyde in all of these these indoor spaces. And we will deploy a network of these monitoring tools in these spaces. But we also going to carry out sampling measurements of VOCs, PMs, and microbiome in these or some selected species in these areas. And additionally, we will complete the monitoring with some questionnaires to target groups in these spaces, mainly focus on quality of life and mental health, using standardized questionnaires. Then with all of this information, we will try to, and using machine learning techniques, we will try to determine, and for sure using the previous knowledge and other sources, we will try to determine which can be the main determinants in these spaces. And on the other side, we have another approach, mainly focused on acute events or determinants that can provoke these acute events. And we selected a vulnerable group, and the fact high-risk outpatients of respiratory diseases. And so leading by the Clinic Hospital in Barcelona, we have a set of 200 outpatients, and we are going to monitor this group of people mainly at home, because these people spend most of their time at home, but also we will try to use a portable monitoring tool for them, and we will we have designed, or we have created a specific protocol to look for these determinants or the main pollutants that can affect or can provoke these acute events to these outpatients. This is our main or the aim of the project.
Quite ambitious as well. Dr. Diapoli, would you like to give us an overview of the In-Child Health project?
Yes. Hello. Good
I hope that
morning
I haven't mispronounced your name as well.
You pronounce it perfectly well, but you can also call me Lila, which is easier if you want. So thank you very much for inviting us to present our project. It was very nice also to follow the previous session, very informative for us. So I'm working in the In-Child Health project. I'm the PI for NCSR Demokritos team. And just a few words about our consortium. Our project is coordinated by Aalto University and consists of 12 partners in 7 countries in total. So now we are in the beginning of our second year. Our aim is to identify and characterize the main factors, causes, let's say, of indoor air quality deterioration, especially in microenvironments that are important for children. So microenvironments where they spend most of their time and are significant for their exposure. So these factors can be specific pollutants. So we will study both gaseous and particulate pollutants, specific chemicals that we suspect that can be important for these microenvironments in terms of the activities that are happening in there, and also microorganisms. And also physical parameters such as temperature, relative humidity, or air exchange rate, which also affect indoor air quality. So we aim to characterize these determinants of indoor air quality to identify their sources and evaluate their health impacts. In this sense, we have an extensive measurement program, which will start actually in the beginning of next year. So we are planning to measure at the schools. We are targeting primary schools, so we're targeting children from, let's say, 6 to 12 years old. So we are planning to measure at schools and houses, both indoors and outdoors, in the 7 cities of the partners. So these cities cover different areas in Europe. So we have Lisbon, Athens, and Barcelona in Southern Europe. We have Vienna in Central Europe, and Copenhagen, Essex, and Helsinki in Northern Europe. And we also want to do personal measurements in students. So we aim for 100 students per country, 20 per school, because we have a schedule of 5 schools per city. So we want to give them for a few days some personal monitoring equipment, so that we can also measure their exposure during their movement around other microenvironments. Of course, the school and the house is usually the most important ones, but we also want to check, for example, public transport microenvironments. So the idea of this measurement campaign is to cover different climatic and indoor conditions that we see in these different European countries. We also plan to do a comprehensive health impact assessment with respect again to children exposure. This will be done by studying toxicity of mixtures of pollutants, by modeling the uptake by the human organism. So we call this dosimetry and toxicokinetics modeling. So we model how the pollutant, especially particulate matter that has a very distinct characteristics, enter the human organisms and where it ends up in the different organs of the child. And also epidemiological studies that will be done in 3 out of the 7 countries, where we will try to link indoor air quality with specific health outcomes, including respiratory infections, asthma control, absenteeism, and neurological and cognitional symptoms. Because of course, the impact that we expect to see in children is very different from what we expect to see in adults. Or other sensitive subgroups such as the elderly, for example. So all this data that we will collect will be used also to develop an online tool, which is intended for non-experts. And we have, our aim is to allow policymakers or other relevant stakeholders and communities to assess the children's exposure and the related health risks for the current indoor air quality conditions, but also to check future scenarios or scenarios of changes in emissions, in sources, changes in habits, and see how this will affect the exposure and the health risks. So, and all this knowledge gained by the campaigns and from the pilot application of this tool will be combined in guidelines and recommendations to improve indoor air quality, to improve children's health, and will be disseminated to different target groups. So we aim to different target groups, from policymakers and authorities, going to school communities, and of course, always the general public. I think this was a quick overview of our project.
Thank you so much, Lila. So, Nikos, you want to?
Yes, quick but extensive. It was actually great, and yes, I am impressed every time because we are doing several of the projects that are part of the IDEAL cluster. They are doing several things which are very much in common or parallel, but there's always something which is kind of an added value and a different, slightly different perspective from each project. So we do hope that we're going to have lots of synergies. This is how our project is called, SynAir-G. And the reason it's called SynAir-G is because our hypothesis has been that any health effects that you get from different pollutants is not only affected by each of these pollutants, but if you put some of them together, you have a multiplicative, you have a synergistic effect. And we do know that to some extent for some of the biological pollutants, at least from previous work that we've done, for example, with allergens and viruses, but we don't know it so well. And we haven't understood its consequences, its implications when you go into specific chemical pollutant, for example, the particles, et cetera, et cetera. It's very complicated. So in order to be able to address this hypothesis and see how much is there from the synergistic effect and what we can do about it, we have set up a program whose main components are, first of all, the monitoring aspect. We do focus on schools. We are in 5 countries where different, again, conditions in each country, but also have socioeconomic and exposure gradients. And in these countries, we're going to be establishing a system with we're going to be monitoring both chemical pollutants, allergens, and also viruses and biological pollutants at the same time. So we're going to establish the system. We're going to put it in the classroom. And they're going to be for the 5 classrooms in each country, 5 countries, as I said. We're going to have a way of assessing the health on a regular basis, basically daily, using a gamified app. So we're going to ask the children how they feel, some questions through a game. And we're going to do that for the whole school year. For a couple of consecutive years. We're going to have about, let's say, 3,000, I think, children that will be assessing their health, both respiratory health, general health, and to some extent mental health, exposure, infections, as you mentioned as well. And well, we're going to see using all this data, because we're going to gather a lot of data from the different exposures and from health. We're going to use AI, but also advanced mathematical approaches in order to be able to analyze the data from the perspective on whether the combination of the pollutants might have a bigger effect than each of the pollutant itself. At the same time, we are exploring the mechanistic background of these interactions. So we have cell models, organoids, lung slices, mice models, so an extensive mechanistic program where we look in vivo and in vitro. If you put together different types of pollutants in different concentrations and in different times, etc., whether you can have also these synergistic effects on inflammation, on the integrity of epithelium, and other relevant outcomes to health. We are, of course, looking into this school environment, looking about the sources. And as Isabella mentioned before, we're going to have an approach that has been developed in Symphony, an approach to be able to monitor and describe all the different sources, so that we associate also the sources and the changing sources with the health outcomes. And of course, we also want, through this knowledge, to be able to go into policymakers, to regulators, and we want, and in fact, hopefully in collaboration with the other projects, to turn this into regulations, into standards, into guidelines, something that can have an impact, an effect on society. I think more or less this is the idea of SynAir-G.
Thank you so much. So those are the ideas, the problem that we want to tackle. And I'm curious now to know a bit more about the solutions that you have planned to develop within your project. Not only the solution, so this is for the future, but from the present, I would like also to know a bit more about the challenges that you are facing and that you have faced in this first year, because as Lila said before, we are now entering the second year of this project. So have you faced any challenges during the previous year, or you are planning to have challenges to develop those solutions? Jose.
Okay, regarding challenges, mainly is try to get proper solutions by the end of the project, for sure. So maybe the first one will be to identify these determinants, and also in its environment, because as you commented before, we have a great variability in its indoor environment that we can find, and even with the time, the season, whatever. And so identify these determinants in some way. So one of the challenges that we have is try to develop proper user-friendly monitoring tools. This is one of the outcomes that is expected from this topic. And we are working to, in some way, improve how these monitoring tools, continuous monitoring tools, can measure. But also, we are working to, we face the challenge to know more about how to interpret the values that they provide, because for sure we have learned a lot about how to interpret the carbon dioxide concentration, for example, and now it's quite easy, or it's standardized in some way, and you can use this kind of measurements to improve or to rationalize the ventilation in different buildings. But also I think that we can also use particle matter sensors, total VOCs, formaldehyde, and can be used, but it's challenging first learn how they behave in the different indoor environments. This from one side, and I think that this could be also then translated into a common task for all the projects, I think, and then for most of the manufacturer of these monitoring tools, that is create also a healthy index or something like this that could be used with these tools in some way to spread the use of these monitoring tools. And then for sure try to, we are also going to work on the treatment solutions to improve the indoor air quality, but we assume that we can deploy this kind of tools everywhere. For example, you talked before about the schools, but I can tell you that, for example, here in Spain, most of the public schools don't have any system of mechanical ventilation. They just open or close the window. So it's, and when you talk with authorities, it is something that is, I think that is not very planned to implement proper indoor air quality improvement system. But so it's also challenging to decide proper solution for each type of indoor environment, and for sure we will try to use the knowledge that we can get through the project to develop a proper solution through guidelines, through monitoring tools, or through treatment tools for improve the air.
Thank you, Jose. So Lila, I saw you nodding, so I guess that you are facing similar challenges in your project.
Yes, I totally agree with Jose. I think for these microenvironments that we are interested in with respect to children exposure, in general, indoor air quality is difficult as in terms of monitoring, because you enter private spaces where whatever instrumentation you will put can affect the everyday life of people, living or working there. And then if you think about places where children are, this gets even more difficult. But on the other hand, you do want to be able to monitor these places and also have good quality data. So you want to be able to deploy instrumentation that will provide data that you can trust. And this is a big challenge, I think, You also want to be able to cover a lot of spaces, a lot of sites, and at the same time, because of the differences you see, the spatial differences, even at the same school or even in a home, in the different rooms. But this means a lot of equipment. So then one can decide towards less expensive equipment for this reason. But then you have to make sure that the data that you collect have a meaning. Another challenge for these places, I think, is also for some of the pollutants, also for key gaseous pollutants that we measure outdoors, related, for example, to traffic in urban areas like nitrogen oxides or carbon monoxide. The levels are low inside in these places, in this microenvironment. So you need to have instrumentation that can go can detect these levels, which is also not always the case for less expensive instruments. So in this sense, one of the objectives of our project is also to try to develop new solutions or upgrade already available solutions for monitoring. So systems that are easy to use, not very expensive, and can cover a range of typical pollutants, gaseous pollutants, also particulate matter in different size fractions, as well as airborne pathogens from viruses to bacteria or fungi. Some of these systems their performance depends on the conditions. So once we put them inside and outside, and we want to compare this data series, it's very important to understand what we are getting as data and what are maybe the artifacts that can be present due to the conditions. For example, relative humidity affects very much the PM sensors. So we have to be very careful about how we treat our data, how we deploy this type of equipment. Within our project, we are building 4 rapid real-time monitoring solutions that we also want to try during the campaigns. Some of these are also developed in portable versions because they will be used for children's exposure. And we are also building a data platform for all this to communicate and provide and collect and store the data. Another important aspect, I think, of this type of projects is to engage also the communities that we target. So in our case, it's the school communities. So we are this data platform that we are building. We are also using to develop a user-friendly interface, which will be in the form of a mobile app and also some informative screens in the schools. So we want teachers, children to see the data that these sensors, these monitoring systems provide. Of course, we will provide this data in an easy way for them to understand, because concentrations in terms of values for them may not be so relevant. They cannot understand what is a high concentration, what is a low concentration. So we are developing air quality indicators, and we will also use some color schemes for this. And we want them to be able to see the air quality in their schools, in their classrooms, to also learn corrective measures when we see that this air quality is not within the range of acceptable, let's say, values. And this is also a system that will interact with the students, so they will also be able to report their own feeling about their air quality, their comfort and health status. And in this way, we want also to show them how these monitoring systems can be of use for this type of environments.
Thank you, Lila. Oh, sorry, but okay. So we will talk about the engagement of, because I hear you talking about communities and engagement. This will be my next question. So, Nikos, how about solutions and challenges for Synergy?
Solutions I can give you easier, because the challenges are very long list. and when I started the project, I had it really very sort of clear and straightforward in my mind. You have sort of a little machine, you put it there in the classrooms, you monitor, so you know the levels of your pollutants, and then you have your filters, different type of filters, so you energize your filters depending on the type of the pollutions, and you have your solution, which is really very far of what can be. So I think, and the list of challenges, or the majority of the list of challenges that we currently have, is related to the logistics and the technical details of each of these two very simple and straightforward approaches, from the feasibility, from the aspect of the real time that was mentioned before, how even details from my perspective on how much data you can move on an amount of time, cost to a large extent, things like maintenance. So you can have a perfect monitor, but if you need to change something in it every week, then it's not very practical. Yeah, so I mean, when I started the project, I went to Amazon and tried to see whether there was something like that for sale, and well, there are some things there, but from what I understand from our colleagues, especially the accuracy is something which is a big challenge. So we do need to have good and reliable data, and there can be in this field, at least in the chemical aspects, really very big variability and really big mistakes, let's say. So low accuracy, so one needs to be certain that what they find is reliable. And of course we have additional again, detailed logistical problems on when we're going to schools and when we want to install, let's say, a box with the different sensors, then we need to have, let's say, a plug to put it in or somewhere in a place. And it happens that in many schools, the space is not good enough. And also we know that it's not the same if you put it on top or if you put it on the bottom. And so there are many little details like that, which we hope to be able to solve in the next years. We are working on that. So this is more or less the challenges,
the situation
from our side, yeah.
As it is. Okay. So now my next question is about, as I said before, community engagement, community involvement, because so these solutions cannot remain just in the projects. They should be uptake. And so this is also the, let's say, the rationale behind these panels today, to have the different perspective, to have clinicians, to have researchers, but also civil society, patients. We were supposed to have also local authorities, but unfortunately they couldn't be available for today. But so my question is exactly that. So how you're envisaging in your projects how could the uptake of this solution could be facilitated? So how to involve a larger community made of policymakers, made of patients, made of civil society. What are your plans for that? José, we have 5 minutes left, so try to be quick,
yeah,
but effective.
Yeah, maybe the easy way is, the easy but challenging way is to try to involve some stakeholders that can support or can guide you in some way to develop these solutions. For example, in our case for outpatients, we are working in a protocol to follow to determine these determinants that could provoke acute effects, but we will involve them in order to identify proper ways to avoid in future, and then through associations or whatever, this will be part of our stakeholders community. Look for the way to get this knowledge and to spread it. For example, the other way for sure is to involve. Is always the same. Is try to involve the users to develop proper solutions. For example, for the monitoring tools, we will try to develop proper user-friendly tools. So with in some way raise some awareness about how to interpret this information. That could be also interesting, but also translated into easy index in order to tell the user if the air quality is good or not, or even just if they could affect their health, depending on the type of people who lives or who stay there. So I think that, yeah, for sure, developing guidelines and policies, or try to propose policies or guidelines to, in collaboration for sure with the rest of the projects, because I think that we have a very good opportunity to collaborate among the 7 projects and other organizations to develop proper guidelines and or to propose proper policies and yeah.
Thank you. Lila.
Yes, I think for indoor quality, we can see a great impact even by changes in the behavior of individual or collective behavior. So sometimes we don't need big measures, but just people that live in these places and work there to understand, as you mentioned before, for example, for cleaning, which is a simple measure to take, but you have to know about it. So we target in, let's say, 3 parts. One is to give the knowledge, give the information. And this, as you mentioned before also in the previous session, is very important to be precise, easy to understand, and targeted to each specific target group. So different guidelines for different target groups, let's say, so that they're specific and they can be easily implemented. We also want to give them to these communities the means to generate their data through these systems that we're developing and the user-friendly interface, so they can also see, assess themselves their air quality, and engage them in concrete action. So we have a set of citizen science activities within the project that will help students to assess their air quality in their classrooms, but also try to implement corrective actions themselves. And I think it's very important to engage them in all the different steps of this process.
Thank you so much. Nikos, how about SynAir-G?
Well, yes, I think that I have 3 main aspects that can take us forward, I think, and one is inclusivity, basically trying to involve as many stakeholders as possible, not only the experts, not only the patients or the public, not only the regulators, but anyone that has an interest, and try to bring them in. It's not very easy because they have different priorities, they have different rhythms, etc. But we need to try very much. Then communication, and again that's a main challenge at the time where people are communicating every second with a Twitter or whatever, and you have so much information. We do need also to put forward this information about its importance and about its potential. So we need to do that, and we can, and EFA will help us in SynAir-G for that. And then what I call science in every policy, and I think this is really, really important. I was kind of impressed when I presented IDEAL in the WHO ministerial conference that happened a few months ago, where there was a session by the European Commission about what they're doing, including IDEAL, in order to deal with air quality. And there was a very strong push from their side to have science and policy very, very close. We are getting at a stage that we cannot just have, unfortunately, of course, because pure science is nice, and I love pure science, but we do need to have policies that stem from this science. And perhaps it's the first time that politicians, at least at the high level, at the EU or the WHO or the international level, they understand that. So we need to work together, the politicians. It will not be very easy, but we do have to do that so that whatever we find has an impact. I think these 3 elements will take us forward, and I am also very much hopeful about the IDEAL cluster and the fact that there is a lot of potential, and there is a lot of science, good science happening there. And of course, from our side, SynAir-G will try to communicate that, collaborate that, try to receive and offer whatever we can.
Thank you so much. I'm very much aware of our time constraints. So if there are questions from the public, I know that here there's a question from Isabella.
Yeah. It's more a comment than a question. I think that when we talk about inclusivity, obviously the industrial settings are to be put inside because, on another side, for behavior, we need to take into account that SynAir-G does it, that people, that there are inequalities in health, in environmental, etc. So asking people to do the impossible because they live close to the traffic zone or running bad school with very polluted, etc. We need to think about that. SynAir-G so far we'll get to the data to compare situation. But this is a very important point because we need to be pragmatic to meet, so offer a solution.
Yes, Thanos.
It's me again, not a question, but a comment. Because we talk about challenges, and I think I talk on behalf of the whole cluster, but I'll focus on SynAir-G that I'm part of. So I guess many of us know about it, but I'll say for those that maybe they don't. So actually what we're trying to do here is, for example, I'll say a couple of examples. So nobody else before worldwide has dealt with such a big variety of parts of the exposome at the same time at once. So nobody. We're trying to do that. Second, we have no operational, if I focus on bioresources, we have no operational real-time automatic mid-cost network, even devices in the world so far. We're trying to do that. And they can continue. Viruses, the same. I mean, we are trying to do things actually that haven't happened before. So of course it's a challenge and we're happy to be a part of it. And I'm quite confident it will be successful. Even if we do half of them, will be successful. And I'm quite sure that Nikos wants to do all of them. But that's the challenge and we are happy to embrace.
Thank you. If there are no other questions or comments, I would like to thank you all, and I will leave now the floor to Nikos for the closing message.
Well, thank you very much. I think it has been great. Thank you very much for the organization. And we've seen the problem and the size of the problem, the impact of the problem, the diversity and the complexity of the problem, the variability between places, but also socioeconomically and many other aspects. But also we've seen about the willingness, the interest, the innovation, and the participation of so many different scientists in order to solve this problem. So I am very optimistic that next time that we meet, we will also have some novel solutions. And I was very inspired by Thanos' intervention. Yes, we're trying to do as innovative and as creative find solutions as possible. So hopefully we'll be able to present such solutions pretty soon. And with that, I would like to thank everybody for the contribution, the panelists, the participants also from far away, and looking forward to having successful programs and successful workshops. Thank you very much.